We're focusing on vein palpation and patient assessment for your phlebotomy certification exam. This is a critical skill, and the exam will test you on not just the how, but the why and what if. Let's start with the absolute basics of palpation. The exam will expect you to know that you must palpate with your index or middle finger, never your thumb. This is a classic exam trap because your thumb has its own pulse, which can easily be mistaken for an artery. An exam question might present a scenario where a phlebotomist feels a pulse at the selected site and asks for the next appropriate action. The correct answer is always to find a different site, not to proceed with the draw. When you palpate, you are feeling for a vein that is bouncy and firm, like a small elastic tube under the skin. This indicates a healthy, well-hydrated vein that will be a good candidate for venipuncture. Contrast this with a hard, cord-like feeling. This suggests a sclerosed or thrombosed vein, often found in patients with a history of frequent injections or IV drug use. These veins are difficult to puncture and should be avoided. The other critical sensation to identify is a distinct pulsation. A pulse means you have located an artery. Puncturing an artery is a serious complication, so if you feel a pulse, you must move away from that site. The exam loves to test site selection by giving you a list of patient conditions and asking which site is inappropriate. You must learn to avoid sites with hematomas, which are bruises that can affect test results if punctured. Also, avoid areas with significant scarring, recent IV lines, or edema, which is swelling caused by fluid accumulation. Drawing from an edematous area can dilute the specimen with tissue fluid, leading to inaccurate results. A common mnemonic to remember what to feel for is, feel for the bounce, not the beat. This simple phrase reminds you to find that resilient, bouncy vein and to avoid the pulsating beat of an artery. Finally, let's discuss anchoring the vein. This is a frequently tested procedural step. After selecting a suitable site, you must use the thumb of your non-dominant hand to pull the skin taut about 1 to 2 inches below the intended puncture site. This action, called anchoring, prevents the vein from rolling or moving sideways as the needle is inserted. Exam questions may describe a failed venipuncture attempt and ask for the likely cause. Improper anchoring is a very common correct answer. Never use the C-hold, where the thumb and index finger are placed above and below the site, as this increases the risk of an accidental needle stick. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.